So we're going to be closing Section C due to a lack of staff this morning.
It's 6:30 in the morning and a section of the emergency department at Kingston General is closing.
Because you're short 2 nurses here.
Short 2 nurses this morning.
That means patients on the move immediately.
So where are we going?
He's going to Delta 6.
Okay.
And you said some of these patients have been moved 3 times?
Oh yeah.
There's bed space in Section C, as it's called, but not enough staff to keep it running.
Now who's next, guys?
The COVID positive patient, the MRSA patient, or the has no isolation patient. He could be a good hallway.
Charge nurse Monica Griffin has to find space elsewhere in Emerge where the remaining staff can keep an eye on the extra patients.
Quite a few will end up in the hallway by the time we're finished. It's not very nice. How you doing?
No, I feel better. How are you?
Okay. This young lady's been here in the hallway all night.
Yeah, I've been in the hospital since 11 a.m. yesterday morning.
That's 20 hours in emergency so far for Missy Calbury, here for a broken ankle and waiting for surgery.
In your mind, did you realize how busy it would be?
No, I didn't. No, not until I came here and I seen it myself. I can't really sleep. People going by, always in people's way. Everybody's sweet here, though, so that's good. They definitely need more people.
Basically, down here now this is what you see. It's empty. 10 empty beds that we can't use. It's like this all the time, or worse. This is just our regular day.
Monica's 12-hour overnight shift is done. She hands off to Angela Arnold, just beginning an already awful shift.
No floats whatsoever coming. That means I have no staff
See
today.
here, look. This is a sheet.
Yeah.
Blank, 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 blank.
Kingston Health Sciences is a trauma center, and for about 500,000 people in the area, it's where you'll likely end up if you have a heart attack or a stroke. And when staffing shortages happen here, they hurt, and not just in the emergency department.
Thank you, Colleen, so much for coming. Are you covering breaks?
Yeah, I'm covering breaks and I can stay till 7.
Thank you.
Nurse Julia Fournier is the program manager for the ICU.
Hi, how are you?
Her job is ultimately to keep the department up and running well, but that is getting harder.
Any more sick calls come in?
Amy is not going to be here.
Oh, no.
Days tomorrow or Sunday.
Okay, I hope she's okay. Hi, good morning. I see that staffing, we are down to 17 this morning, which is very challenging.
At the unit's daily staffing huddle, Julia reports that they only have about 50% of the people they need.
I put out all the SOSs on social media and emails and texting, and I'll continue to shift level as best I can. That's where we're at. Thank you.
Thank you.
Is that a good call, or I can't tell if this is
It's
a
a
good
pretty
day.
typical call. We just try to plan for the next 4 hours. What's the next double we can make? So 1 nurse to 2 patient ratio. Is there a triple we can make, a 1 nurse to 3 patient ratio, which is never heard of in critical care.
Does that mean you're worried about the care people are getting?
I know the nurses provide excellent care. That's not, but it stretches them. I knew it was going to happen.
I'm so sorry.
I do worry about them because of the moral injury and the moral strain. They're tired. I'll collect myself. They've been through a lot with the pandemic. Yeah, it's hard. I have many conversations with them. I worry about them.
And then you take that on.
Yeah, I do. It's really, really hard to see your team struggle like that. Yeah.
And I look around your office here, and it's full of things people have said to you. You're doing an amazing job, your hard work and dedication.
Yeah, they see it. And recognition is one of the ways that we support each other. Yeah, I care deeply for this team.
Hello, it's admitting.
And look at this. This space is basically the hospital's air traffic control.
Do we have any surgical beds coming up? Any pending discharges for tonight?
No, I've used everything I possibly can right now.
Where finding bed space for patients seems just as hard as finding the staff to care for them.
And do any of these floors have hallway or conference room patients?
It's the domain of Renee St. Pierre,
So we need to move them out of the wardroom.
a registered nurse for over 20 years before taking on this role full-time.
What do you see when you look at these screens?
Which beds are empty, who needs isolation. So we have medicine patients on surgical floors, surgical patients on our perinatal floors. Like, we're just trying to fit people in where we can, especially when emerges in a crunch. We just move people up. Sometimes it's to hallway spaces. We've opened up beds that used to be storage rooms, so now that they've revamped them and opened them up into patient care areas. So it's not just these things here. These are all patients that are either waiting in the community or at another hospital that are waiting to come to our facility.
To be transferred here?
So this is another place that that kind of gets missed, I think, when we hear about all the things that are getting dropped in healthcare right now, is they're waiting at home for this bed.
So those two privates, do we know if any of one of them are going to be going home anytime soon?
Amy Dawn Asford and Brenda Hutchins work the phones, checking every department, every unit for a safe space.
Hi, it's Renee. So yeah, we don't have any beds. So we'll have to move someone from your floor. Is there anyone going home that we could actually cohort those 2 MRSAs in a semi? No, okay. Thanks. Okay, bye.
Time to head back to the emergency department with Renee.
Just gonna let them know where we're at with beds, because we physically just don't have any beds left.
The ER is busy today, like really busy.
Yes.
So that's not the answer they need, right?
No, it's not what they want to hear from us, no.
Oh, wow. Okay, there's people everywhere right now.
Hey, Ange. So just coming down to give you an update on beds. Going into tonight, there is going to be 2 ICU beds. Looking and hoping for some more surgical discharges to get anyone else out, but there's going to be 1 bed there. Other than that, med-surg is pretty much full now.
Hi there, it's Angela Charge.
So that's a doctor calling to let her know there's another
Okay,
patient that needs to come to
all
us. I'm just going to put 1 right beside the desk where there's 1 vacant spot. If you look around
Right
there,
there?
there's 1 space.
Right by the admin desk.
Yeah.
That's it. There's literally nowhere else to go.
I need nurses and rooms.
Okay. So is there anything that I can realistically get you today? No. Okay.
We've known this was coming. We've warned that this was coming.
Dr. David Messenger is the head of emergency medicine. He says the system has been starved for years.
We've really become the door to healthcare for so many people who can't access it in any other way. Patient group that's getting older. No one banked on 2 years where those people wouldn't be able to see a doctor.
Right. So things are getting worse.
Things are getting worse. People are getting sicker.
So the good ideas almost always come from the people whose boots are on the ground. What's even a little thing that would make life better?
We've struggled for so long to find more efficiencies in the system so that we can help people move through the system faster, more effectively, more efficiently. We need system-level solutions. We need change that would allow enhanced scope of practice for different types of care providers.
So still no way to open up C though?
I'm going to open it up with 1 nurse.
With 1 nurse?
Hopefully keep it going with 1 nurse.
Just 1 nurse means Section C can open up for the night. Still, there is a dread about what tomorrow will bring.
You leave here and you think it can't get any worse, and it does. Like, how much more can you take?
But somehow they seem to just make it through.
Somehow we were able to gather together and make sure that the sickest gets treated, and they will. If you're the sickest you're going to get in, somehow we make it happen.